Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How do you administer a Praluent injection? Praluent is a subcutaneous injection, an injection that goes under the skin, that comes as two different forms. Praluent prefilled syringe, single dose, Praluent prefilled pen, single dose. It is important to have training from your healthcare provider before you or someone else injects your Praluent. Follow the instructions every time you administer the Praluent pen or syringe. Where do you inject Praluent? You can inject Praluent into the front of your thighs, which is the top part of your leg between your knee and hip, which is right in front of you when you are sitting down on a chair. You can also use the lower part of the abdomen but not around your belly button. Your injection needs to be at least 2 inches away from your belly button. If you have someone else giving you your injection, they can also use the outer area of the upper arm. You should only inject into clear, healthy skin. Do not inject into any areas that are bruised, tender, red, scaly or hard. You should also not inject into any scars, stretch marks or areas of psoriasis. If the same area is being used, then you should inject into a different spot each time. How do you inject a Praluent prefilled pen? Handy tips. You can take the Praluent prefilled pen out of the refrigerator about 30 minutes to 40 minutes before injection time. This way it will warm up to room temperature and will be more comfortable to inject. Do not shake the Praluent prefilled pen before use. Step 1. Get everything you need ready: your Praluent prefilled pen, alcohol wipe, cotton ball and sharps disposal container. Step 2. Wash your hands before you start, then clean the injection site with an alcohol wipe and let the area dry. Step 3. Check liquid through the viewing window of the Praluent prefilled pen. It should be clear and colorless or pale yellow. If it is discolored, cloudy or you can see particles in the liquid, then do not use IT. Step 4. Hold the pen in a fist grip and pull off the blue cap. Discard the cap right away. Step 5. With your other hand pinch the skin of the injection site to make a firm bump. Step 6. Hold the pen 90 degrees to the skin. Press the pen firmly against your skin until the yellow safety cover is no longer visible. Keep holding the pen in this position. Step 7. Push the green or gray button at the top of the pen, then immediately release the green or gray button. The pen should click and the injection will start, which may take up to 20 seconds to complete. You need to keep the pen in position until it has finished. Step 8. The injection has finished when the whole window has turned completely yellow. You can now remove the pen from your skin. Step 9. Press the cotton ball against the injection site for a short period of time and then place a small adhesive bandage over the injection site if required. Step 10. Throw away the used Praluent prefilled pen in your sharps disposal container. How do you inject a Praluent prefilled syringe? Handy tips. You can take the Praluent prefilled syringe out of the refrigerator about 30 minutes to 40 minutes before injection time. This way it will warm up to room temperature and will be more comfortable to inject. Do not shake the Praluent prefilled syringe before use. Step 1. Get everything you need ready: the Praluent prefilled syringe, alcohol wipe, cotton ball and sharps disposal container. Step 2. Wash your hands before you start, then clean the injection site with an alcohol wipe and let the area dry. Step 3. Take the Praluent prefilled syringe from the packet. Check the liquid inside the prefilled syringe. The liquid should be clear and colorless or pale yellow. If it is discolored, cloudy or you can see particles in the liquid, then do not use IT. Step 4. Remove the needle cap from the Praluent prefilled syringe and throw the needle cap away. Step 5. Hold the prefilled syringe in one hand, then with the other hand gently pinch the skin at the injection site to form a firm bump of skin. Then insert the needle into the small bump, making sure you push the needle in all the way. Step 6. Put your first 2 fingers on the finger grips of the syringe and with your thumb on the top of the plunger slowly push down the plunger as far as it can go. Once it is fully depressed, you should leave the injection in place for another 5 seconds to make sure all of the medicine has been injected. Step 7. Once the injection is completed, you can remove the injection from your skin by pulling the injection out at the same angle as the injection was inserted. Step 8. Press the cotton ball against the injection site for a short period of time and then place a small adhesive bandage over the injection site if required. Step 9. Throw away the used Praluent syringe into your sharps disposal container. For more information, with diagrams, on how to administer Praluent prefilled pen or Praluent syringe, see Praluent Counseling information, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.